We now move to premenstrual disorder. This has often been referred to as PMS, premenstrual syndrome. So what do you think of this license plate? Actually, whoever made this license plate did not know what they were talking about, because if the symptoms are 24/7, if they never go away, that's not premenstrual syndrome. Here's our case. A 36-year-old patient comes to the gynecologist's office complaining of depression, anxiety, irritability, breast tenderness on a monthly basis. Her symptoms most commonly occur 2 weeks before her menstruation, and then when her menses start, they are gone. This is a classic finding for premenstrual syndrome. I suppose almost every woman who has ovulatory cycles has some premenstrual symptoms, but they're not typically severe enough to cause any significant impact on her life. But PMS is where they are severe enough to cause functioning difficulty. PMDD is your psychiatric term for premenstrual dysphoric disorder, and this is the severest form. We start with a symptom diary. She keeps a diary through 3 consecutive menstrual cycles, indicates what symptoms are present, when they start, how severe they are, when they go. They need to be recurrent in 3 or more consecutive cycles. They need to be absent pre-ovulatory, and the symptoms are present only post-ovulatory. They are severe enough to interfere with normal functioning, and they will resolve with the onset of menses. And the timing is more important than the specific symptoms. There have been 150 different symptoms described with this disorder. So there's no specific symptoms. It is their relationship to the menstrual cycles. Here we have the weeks of 3 cycles. This is a 3-week cycle, 21-day. This is a 4-week cycle, 28-day. This is a 5-week cycle, 35-day. And what I want you to notice, the pre-ovulatory is symptom-free. And so the amount of time will depend on how long the cycles are. It is the pre-ovulatory, which is symptom-free. This is day 14 before the menses, 7 days before the menses, and you can see PMS symptoms get worse and worse and worse, but once the menses start, they should get better. Dysmenorrhea gets worse with menses. PMS gets better with menses. This shows a PMS diary. It shows the days of the cycle, which are horizontally here, and we grade the symptoms: 0, none; 1, mild; 2, moderate; 3, severe. And the symptoms could be nervous tension, mood swings, irritability, anxiety, weight gain, swelling, breast tenderness, abdominal bloating, headache, fever, chills, and lots of different ones. As I said, 150. My suspicion is that we have clustered a whole group of entities together here and call them PMS, and I don't think we really know what we're talking about. Do you know of any disorder that has 150 symptoms? They could be fluid retention, breast tenderness, weight gain, bloating. They could be more autonomic, heart pounding, confusion, and so on. If they are fluid retention, you may want to try a potassium-sparing diuretic. If they're emotional, nervous tension, mood swings, depression, and so on, then you would treat that differently. If they were musculoskeletal, aches, joints, headaches, cramps, then you may want to give nonsteroidal anti-inflammatories. And in some ways, this may sound a little bit like chronic fatigue syndrome, fibromyalgia. Very difficult to really pin it down. In terms of treatment, it certainly makes good sense to get your nutrition right, decrease caffeine, sugar, and salt, balanced diet, relaxation, regular exercise, support groups. I've got a picture of support groups in just a minute. Historically, progesterone suppositories have been used for PMS. They did work in some patients, but what was interesting, when you do a randomized, prospective, placebo-controlled trial, many patients with placebo also do better. And in fact, we really cannot differentiate those who benefit from progesterone suppositories or not. So that is not considered a first-line treatment. In terms of treatment, SSRIs, fluoxetine was the first medication that was used for that, have been successfully used. And more recently, a new oral contraceptive that contains drospirenone, which is given 24 days out of 28 days. The trade name is Yaz. This has been recently approved by the Food and Drug Administration. This shows all the support groups listed in the Los Angeles Times, and I suppose there's something for everybody, including PMS in here. And the benefit of the support group is you don't have to explain what's going on, because everybody understands. This looks at the pharmacological treatment for PMDD. You can see fluoxetine, sertraline, paroxetine. A variety of different ones can be used. And what is interesting is you don't need to give it continuously, such as you would typically with depression. You can give a low dose, starting with 10 milligrams, and start it 2 to 3 days before you know the symptoms will begin. This is the first and only prescription medication indicated for PMDD, Serafem. Sera, serotonin, fem, female. She was out of control, now she is in control. Out of the darkness into the sunshine. More like the woman she really is. And fluoxetine. Fluoxetine is really just another name for Prozac. So you need to make sure the patient isn't getting a double dose, but this is really what it is. Now, the new one, which is just recently approved by the FDA, which is Yaz, contains drospirenone. And the important thing here is it is a 24 out of 28 days. Normally, oral contraceptive pills, you use 21 and then 7. This is 24 days of active pills and 4 days of placebo. And the argument here was that during the pill-free period, the hormone-free period, that's when women got their symptoms the worst. And so by limiting the number of days off, you have less less likely the recurrence of the symptoms. Of course, if you want something more natural, a more natural remedy, use pycnogenol, and I have no idea what that is or whether it works. You know how you can have a lot of cravings with PMS? This is Welcome to the PMS Diner. Our special today is Hershey Bar Lasagna. That comes with M&M soup and mashed Snickers with hot fudge gravy. All right, and that's the end of premenstrual disorder.